Hey, welcome back to movementprofessional.com. Today I want to talk about a topic that just came up. I was doing some pull-ups and working on some butterfly pull-ups, and you can see right here, developed a nice group of blisters, and it's a fresh wounds, and it's quite painful. So I wanted to discuss, some strategies to go over dealing with some acute pain. This is just a simple example, but really any pain or that's acute or even more chronic, which is certainly more complex, but these strategies should hold for that as well. So one of the things I wanted to discuss though is what happens to the nervous system when you're in pain, and maybe actually some strategies to calm that pain down, and some exercises that you can do for the mind to actually calm that down. So first of all, you gotta make sure when you're feeling pain, you want to just look at your breathing immediately. Look at how that's changing. Often you'll be holding your breath, and if you're holding your breath, then the pain will likely just intensify. When you breathe in, if you're taking a lot of inhales, your heart rate tends to go up, and when you breathe out, your heart rate tends to go down. So from a standpoint of what the nervous system is doing, especially your autonomic nervous system, which is your sympathetic and parasympathetic. The sympathetic being the fight or flight response, which everything kind of gets amped up if that's overactive, and then the parasympathetic, the rest and digest system, which calms everything down. You tend to cue that parasympathetic response if you can take longer exhales. So immediately when experiencing pain, you're going to have a natural reaction they're not going to be able to do much about. But once you can kind of settle in and actually come back to the present moment, try to think about taking longer exhales, trying to relax all the muscles in your face, relax all the muscles everywhere around the area, and just actually, instead of trying to distract yourself from the pain, try to go after it, go look into it, and just see what is the sensation. So right now I'm sitting here, and right in the top part of my hand it feels like a burning sensation, and actually saying that, or saying that in your head and conversing with yourself a little bit, makes the pain a little less aggressive, and it certainly makes it a little less scary that it's just a physical sensation. There's nothing more to it, and it will come and go, and then you can kind of move on from there. So this isn't a discussion about just like toughing things out and pushing through pain. This is just sometimes these things happen inevitably. I treat people that are in pain all day long, and it is important to have strategies for dealing with pain, other than medication and things that are already prescribed out there. All right, so I'm not trying to prescribe anything, but I think it's an important practice of mindfulness to just be able to sit with your pain sometimes and just notice it, and you can notice if you can calm your breathing down, if you can relax other structures in your body, relax your face, put the back of your tongue to the back of the tip of your tongue to the back of the two front teeth, which will help you relax your facial muscles. You may be able to calm some of this acute pain down. All right, see you next time.